Victoria's southern Mallee is a really special rural place. Fields of wheat, barley and canola, the rainbows, the mighty river, the sheep and the cod. It should be a place where everyone feels safe, comfortable and happy, a place to call home. But for some people, life is hard. Imagine the mum whose son gets called a monster, the loving husband who plans to drive his car into an oncoming truck on a lonely road. He just can't take another day. A man who is sick enough to lock up but then sent home with no support. Imagine a young girl who carries a noose in her bag, a mum at the local hospital pushed out. It is her child, but he is an adult, so she is ignored. Special places nurture you. You know where to go to find help, and there are people to support you every step of the way. But what if your special place is isolated, lacking services, and no one seems to know where to go if you need help? Imagine leaving your farm in the dark hours every week and making the long, lonely drive to the city. Care for your children with mental illness not available in your own town. The guilt of a mum who describes her sadness. If my daughter had cancer, everyone would come with casseroles, but she is mentally ill, so no one wants to know. There are 600,000 Australians with serious and enduring mental illness. They all live in special places. Their lives are not easy, creating crises to get help, travelling long distances for services, bearing the brunt of stigma from those who don't know and those who should know better. We are told to focus on success rather than barriers or issues, searching for success amongst the stories of heartbreak, pain, suffering, stigma and isolation. But what is success? Henry Ford once said that coming together is a beginning, keeping together is progress, working together is success. Our success cannot be measured or thought about in terms of solutions, answers or wins. The Where Do I Start project was unique in that it brought together people with enduring mental illness and people who design and deliver services. We explored service access in small rural communities in the southern Mallee catchment. We heard stories from 20 amazingly resilient consumers and carers who live the barriers and issues every day. We laughed and we cried as we recognised our shared humanity. We explored options for stigma reduction, service coordination, early intervention to avoid crises, professional development of health workers and other support workers, improved discharge planning, recognition of the role of families and carers, different methods of engaging with people, and models for central coordination. Our biggest recommendation, however, was for a multi-sectoral, whole-of-system body of work to support a planned and systematic approach to addressing multiple system failures for those people with enduring and serious mental illness who live in special rural places. If success is solutions, we have failed. If success is measured by working together, we have been successful, but it really is only a beginning.
When we walked in fields of gold, when we walked in fields of gold.